Our next speaker is Professor Kelsey Hegarty. Kelsey Hegarty holds the Joint Chair in Family Violence Prevention at the University of Melbourne and the Royal Women's Hospital, and co-chairs the Melbourne Research Alliance to End Violence Against Women. She's also a practising GP. Her CV goes from here to the end of St Kilda Road, so she's given me permission not to read the rest of it out, but please put your hands together and welcome Professor Kelsey Hegarty.
Hi, can you hear me? Yes. When I was asked to speak on the family violence reform, what we need to know, I needed help. So I invited Rachel Green, who is a tireless campaigner for a very long time for the well-being of survivors, and who, for her sins, is helping with the reforms. And it's a huge task, but also it's a changing task. So although I'd been involved quite a lot with some of the reform around the multi-agency risk assessment and management, it was important to also be very sure that what we're telling you is where we are at the moment. So welcome Rachel Green, who is the Director of Risk Management and Information Sharing at Family Safety Victoria. And Rachel's actually going to start.
Okay. Thanks, Kelsey. Thanks, everyone. Is that okay? Feels very... Yeah? Okay. I'd also like to acknowledge the traditional owners on the land on which we're meeting here today, pay my respects to elders past, present and future. So as Kelsey said, can we go to the next one? I'm one of the directors in Family Safety Victoria. I'm going to be lightning speed. Kelsey's given me, you've got 2 minutes. So this is Family Safety Victoria in a nutshell. Most of you will know the key areas. This is the Royal Commission key reforms being implemented. The area that I manage is the family violence information sharing reforms and the redevelopment of the CRAF. The other key areas are, of course, the support and safety hubs, the Orange Door, of which 4 are now up and running, the industry plan, and the central information point, which a number of you might be aware of. Next one. Now, this is where we're up to with what we're now calling the MARAM. So, Family Violence Risk Assessment Risk Management Framework became known as the CRAF to all and sundry. It's now called MARAM, Multi-Agency Risk Assessment and Management. We're calling it the daughter of CRAF. It's the name is to signal. This is the next iteration. This is the contemporary evidence. We've been working with KPMG in a consortia that's include University of Melbourne, Kelsey Humphreys.
We often get confused. She's sort of shorter and a social worker, but anyway. Kathy Humphreys.
Kathy, it's so different. Who have done an enormous amount of evidence-based reviews to inform really the practice, the suite of risk assessment tools. I just want to call out the top part of this very complicated structure is kind of where we're up to and where we've landed. So we have a strong and clear policy framework which has, the 4 key pillars that you can see up there. I think some of the things are just to reiterate what we've heard this morning from Rosie and others in relation to we need a shared understanding of family violence which has contemporary understandings of family violence risk. It has to be underpinned by a gendered understanding of family violence. It has to address victim blaming in all parts of the work that we do. Everyone has a role in family violence. Key message from the Royal Commission. That's what this framework is trying to iterate. It's a massive task. It's a whole of system task. Not everyone has the same role. So that, different people have different responsibilities. We have specialist parts of the system and they need the most contemporary, comprehensive risk assessment practice, guidance, organisational support. All of the messages that we've heard around what's strengthening hospitals, the work that's going on, it is absolutely the mirror of what this is. This is the framework that needs to sit over the work that's happening, which sounds just fantastic and so good to hear about how it's progressing. Outcomes evaluation also underpins. How am I doing? You're doing well. Okay. Sitting underneath this is where we're up to. So I think you know, we've done a lot of consultation over the last 6 to 12 months. Many of you will have been involved in consultations with Kelsey and Kathy in relation to looking at the tools. How do we get the risk assessment tools right, the questions right, so that that practitioners feel confident? Again, Rosie's point about how do we skill up practitioners so they know what to ask and then know what to do and know where to refer. This means then the rest of the system reforms need to come into play. We need specialist services, we need hubs, but we need, you know, just to know where to go. And we also need to know how to skill up practitioners, particularly in the health arena, so they can hold that risk and feel confident to do that with secondary consultation and support from across the system. There's a lot of work going on around practice guidance, and I think the point that you've so clearly messaged, the Strengthening Hospitals work, this is organisations. You know, the leadership is so critical. So there's a lot of tools, resources that need to skill up organisations to do that work, and leadership is so critical in relation to that. Is that enough? Yeah, that's. Oh, next one. So, as I said, we talk about three reforms, because the Children's Information Sharing Scheme is what the government has brought in the last 12 months. So practitioners there's no way we can go to 3 rounds of training, family violence, child and MARAM training. So this is our attempt at trying to phase the workforces into the training. Family violence, for many people in the room, will have started in February. This is September. Primarily the 2 information sharing schemes. For many of you, this won't be in your remit. You'll be looking to 2020 in relation to when you will be prescribed working within hospital settings. So there's lots of information on the website. There will be training in relation to what do you need to do. The key thing is that, you know, organisations need to know, how do we respond to information sharing requests? That's the critical element.
Okay, I thought there were a lot of acronyms in medicine, but here it is at an absolute forte. But the nicest thing I heard from a colleague who speaks Arabic is that MARAM means hope. His sister is called MARAM, and he thought it was so funny that I was going to something where I was going to speak about MARAM. And I actually thought we should maybe check that and look it up, because ISEs, RAEs, MA, CRAF was always a problem, because, you know, if you didn't say it properly, you know. So I think that MARAM and hope is a very good way to go. Can I have the next slide? But I think we are only at the beginning, and our main role, if any of you looked at the Australian Institute of Health and Welfare document that's recently come out, health professionals were the highest group told over and above police, so of current domestic violence. So we have an enormous, important role in screening and identification and reorientating to risk management and information sharing. A challenge for us is the recurrent and tailored training. Who's going to train us?
This is an enormous question, obviously. We don't have enough trainers. So there's the work I think the Royal Commission called out around the industry plan. We have to build this. We've got great specialists. We've got DVRCV. We've got good pockets of trainers and some good TAFEs in relation to that. But we need to build a system of specialist training. Our key learnings from the Family Violence Information Sharing Scheme is to actually train in this area, where you need to actually skill up people around understanding risk before they can then share it effectively, is a key one. So it's a big part of the work.
And strengthening hospital response, the next adaptation of the current toolkit will include some MARAM evidence. But, you know, if we're looking at this money phasing out, we need to really be campaigning for having very specialist, health-based, I don't mean specialist family violence. And, we are on a change trajectory, and I think I'd like to stop about the referral pathways. I think lots of people are thinking referral into the orange door is the way to go for every single person. So would you like to comment on that?
Yes. I think the question of, as we build capacity, literacy across the system, the knowing what the impact of that is going to be in relation to increased referrals is just part of the forward, we just have to think about what's going to happen. There are 4 safety and support hubs, orange doors at the moment. There will be 17 by 2021, but it's one part of the system. It's a really important new part, entry point into family violence, family services, men's behaviour change services. Of course, there will be specialist family violence services continuing to operate family services. So I think it's a bigger picture, and child first as part of family services.
So I think a key message is that it's not the only answer, and we still need to work with the whole of the community sector. And we all struggle with the final point up here, which is about data capture. And I know that all SHRVs have struggled with this, but that's into the future as well, where we can seamlessly be collecting similar data electronically. So if I could have the next slide, and some of you all seen this in the consultation, and we heard Rosie say that in fact, you don't want to tick box, have you experienced domestic violence? We do know that practitioners do like a bit of a script. You have to introduce it by saying, we ask everybody in this place if it's antenatal clinic, or I frequently ask people who present with this. And these are the sorts of questions that from our evidence review were suggested as being good questions to ask. And then working out, is she safe to go home? Her own assessment of herself and her children is the key to trying to work out who's high risk and who's not. If I could have the next slide as well. We've also looked at what are the high risk indicators, and I think that as a frontline worker, I want to work out who I absolutely have to get to a specialist service, either social work or a community specialist service. And so these are the questions that are, are high risk. And it looks a lot, but I can do this. If I can do it, you can do it. And, you need to do it in a way that says, I'm worried about your safety, I want to help you, and these are the set of questions that I want to ask you to just reassure or try and work out what's the pathway to safety and healing for you. It doesn't mean risk and safety are the only things, but certainly in terms of needs. So we're going to finish with some key questions that I've had a lot over the last little while. So next slide. And Rachel's going to try and answer them. So the first one I've been asked a lot is, because mental health and alcohol and drug are actually supposed to be aligned by the 27th of September, and a lot of you have those within your health services, what's going to happen? What if they don't? What's going to happen to us if we're not all aligned on the 27th?
There's a law? No.
Yeah.
In terms of the MARAM, from September 28th, not much will change. So I think part of the key message we really want to impart today is that the transition and the change around this is significant. For mental health services to think about aligning their policies, procedures, practice guidance and tools with the MARAM is a substantial task, and it's one that will happen over time. As mental health in health think about their, when they will revise their data capture. Think about what are the risk factors that they need to be captured according to what are the responsibilities that their mental health clinicians are doing in the context of family violence. So it's a piece of work for every sector. It's got to look different.
So the answers in the last minute we've got for antenatal care, ED, for hospitals generally, when and if, and GPs because they work in hospitals, when are they all going to have to be doing something? Risk assessment or ISE, information sharing.
So the previous slide, we have that scope of workforces sitting in 2020, but there's been no decisions about that. That's just giving it space in relation to recognising that to build, the readiness of that breadth of workforces, because education is also in that remit, is enormous, and it was going to need time to build and get ready for that. But there'll be consultation around that with everybody in relation to what that's going to look like. GPs, I think, is probably a slightly different issue. I think it's really worth mentioning how significantly the Royal Commission called out and had a range of recommendations around GPs being part of the system, and they need to be. But how we do that in terms of prescribing them under regulation is not uncomplicated. They're Commonwealth agencies and so on. But I think it's about the work going on in primary health networks, how we build and leverage the kind of work that's going on, I think, as well as what's happening through the Strengthening Hospitals program as well.
So I think the message is, stay alert to the bulletins. Can we have the next slide? There's places we can look to see, but we don't need to be alarmed. It's a process, and I'm really excited about Marram being hope. Okay, thanks very much.